All right, today we're going to break down the absolutely staggering scale of the global mental health crisis, and we're doing it using the latest numbers from the World Health Organization. So let's just jump right in, because honestly, these figures are, well, they're truly eye-opening. So first things first, let's talk about the sheer scale of this. Get this, the WHO estimates that more than 1 billion people are currently living with a mental disorder. That's nearly 1 in every 7 of us on the entire planet. So right off the bat, we see this isn't some niche issue. It is a global reality. Okay, so what about the economic hit? Well, if you look at just depression and anxiety, the cost in lost productivity is estimated at a mind-blowing 1 trillion US dollars. And that's not a one-time thing. That's every single year. This doesn't just hurt individuals, it impacts entire economies. But the economic cost is one thing. The human cost, that's what's truly devastating. Suicide now accounts for more than 1 out of every 100 deaths worldwide. And for every single one of those deaths, there are an estimated 20 other people who attempt suicide. It's an unbelievable tragedy that touches every single country. So, when you put all those numbers together, the picture is pretty grim, right? And that leads to the big question. With a problem this massive, why is our global response so inadequate? That's exactly what we're going to dig into now by looking at the data behind the crisis. So, to really get our heads around this crisis, we've got to start by looking at the numbers in a bit more detail. Just how common are these different conditions? Okay, so when you look at this chart, one thing just jumps right out at you. While there are a whole bunch of different disorders, anxiety and depression are by far the most common. Together, they are the lion's share of all cases, and that tells you a lot about where the biggest public health challenge really is. And it's so important to remember, these aren't just, abstract percentages on a screen. Every single one represents a real person whose life is deeply impacted, often through years of living with a disability and, tragically, a life cut short. And that impact on individual lives brings us to our next section, the price of neglect. I mean, what is the real, tangible cost when these conditions get ignored on a global scale? Well, the hit to someone's quality of life is just huge. To measure this, experts use something called years lived with disability. Basically, it's a way of measuring time spent living in less than perfect health. And mental disorders are the second biggest reason for this, making up 1 out of every 6 of those years worldwide. And here's where it gets even more heartbreaking. It's not just about quality of life. It's about life itself. People with severe mental health conditions die, on average, years, sometimes decades earlier. And it's often from preventable physical illnesses that just go untreated. For someone with bipolar disorder, we're talking an average of 13 years shaved off their life. 13! For schizophrenia, it's 9 years. So this all leads back to that central, nagging question, right? With a problem this widespread, this costly, and this destructive, why on earth are our systems failing so spectacularly to deal with it? Well, to answer that, the WHO data really points to 3 huge problems. You can think of it as a triple threat: a gap in money, a gap in access, and a gap in priorities. Let's dig into each one. All right, first up, the money. Just take a guess. What slice of the entire healthcare pie do you think actually goes toward mental health? Yeah, the real answer is pretty shocking. On average, countries dedicate just 2% of their health budgets to mental health. That's it. A tiny, tiny fraction for a crisis that, as we just saw, hits 1 in 7 people. But wait, it actually gets worse. It's not just about how little money there is, it's about where that little bit of money is going. And that is a huge part of the problem. Get this. Nearly half of that tiny budget, 47%, is funneled into these big, old-school psychiatric hospitals. This model of care can isolate people, and it sucks up all the oxygen and the money from the modern community-based services that we know are often more effective and easier for people to actually use. Okay, so the money is scarce, and it's being spent in the wrong places. What about the people who are supposed to provide the care? This brings us to our second gap: access. I mean, just look at this graph. The difference is staggering. In high-income countries, you've got over 60 mental health workers for every 100,000 people. Now look at low-income countries. It's less than 1, not even 1 full-time worker for that many people. That gap isn't a gap, it's a chasm. So you've got almost no money and almost no trained professionals, especially in poor countries. The obvious question then is, who actually gets help? Okay, so in wealthier countries, about 71% of people with psychosis get some kind of mental health service. Now, it's not perfect, but, a majority are getting at least some help. But now, look at the number for low-income countries. Just 12%. 12 for the exact same condition. The disparity is it's unjust, and it means millions and millions of people are left with absolutely no support. And if you think that's bad, when we look at the most common conditions like depression, the picture is somehow even worse. Globally, fewer than 1 out of every 10 people with depression gets what experts would call even the bare minimum of adequate care. Just let that sink in for a second. That means over 90% are basically on their own. So, when you step back and look at all this data, what's the takeaway? Well, it shows this massive, profound gap between an overwhelming human need and our completely broken response. These numbers are more than just data points. They are a blaring alarm, an urgent wake-up call for all of us. The head of the World Health Organization, Dr. Tedros, really said it best. He said, there is no health without mental health. And that's the whole point. This isn't some add-on or a nice to have. It's the absolute foundation of everything. And that leaves us with one final thought. After seeing the sheer scale of the suffering, the unbelievable economic cost, and the systemic failures we've just walked through, the real question isn't, can we afford to fix this? The real question is, how can we possibly afford not to?